My name is Dr. Kobus Roux. I'm a psychiatrist at the Life Mental Health Unit at Life Glenview. So ECT is a treatment modality that we use for depression in resistant cases. A lot of people think that we give a shock to the brain, which is not right. We actually just give a small stimulus of electricity to the brain, and this induces an epileptic fit. And we want the epileptic fit to last for about 20 to 30 seconds, and we control it with anesthesia and muscle relaxants. So the most important indication for ECT is depression when there's treatment resistance. So if someone does not respond to the initial treatment, we use ECT as third or second line of treatment. We also use it in depressive episodes where it's an emergency, where there's acute severe depression, people are catatonic, they're not moving, they're not eating, and it becomes a health risk. We can also use it in manic patients. We can also use it in bipolar depression because using a lot of medication in bipolar can destabilize the mood, and in psychotic patients that does not respond to other modalities of treatment. Another place where it is almost a treatment of choice is in pregnant women, because we do not want to use too many medications when someone is pregnant. And sometimes in the elderly, we can also use it in agitated, demented patients. The most important benefit of ECT is the fast onset of action. With medication, it takes a bit longer to see if someone responds to medication, because you have to wait to get steady state in the bloods and then for the onset of action of medication, where with ECT the treatment response is much quicker. The most important exclusion criteria for ECT is if you can't take anesthesia. So if you're allergic to the anesthetics or allergic to scoline, which is the muscle relaxant. Then another contraindication might be if there's raised intracranial pressure. So we usually do testing to exclude raised intracranial pressure. Actually, ECT is a very affordable modality of treatment. Most medical aids pay for it from the hospital benefit, and we can also accommodate private paying patients. ECT is actually a very safe treatment. There are no long-term side effects, and there's less side effects than when you take a lot of medication. The only side effects that you will experience is during the ECT treatment. So we give about 6 sessions of treatment through a 2-week period. And in that 2-week period, people may feel a little bit confused and they may have memory problems. This leads people to think that their memory is eradicated by ECT, which is not the situation, but you will experience memory problems while undergoing the treatment.
On the day of your treatment, you'll be welcomed at reception and admitted to the Life Mental Health facility. You'll be accompanied to your room ahead of the procedure. You should not eat or drink anything from the night before the procedure. You'll be brought into the special ECT treatment area. Before the treatment, you'll be examined mentally and physically to ensure that you are fit to undergo the procedure. Your psychiatrist and nurse will explain the procedure to you, after which you will receive a short-acting general anesthetic and muscle relaxant to ensure that you are comfortable, completely asleep, and unaware of the procedure. Our clinicians will monitor your vital signs before, during, and after treatment. Small stick-on electrodes will be placed on your forehead to record your brain's electrical activity during the treatment. An oxygen mask will be placed over your nose and mouth to ensure the optimum delivery of oxygen to your brain and body during the procedure. ECT is performed once you are completely asleep under anesthetic. A nurse will hold the paddles in place while a doctor who has specialized training in electroconvulsive therapy administers the small amount of electricity. This will cause a short seizure. The total duration of the treatment is very short, lasting mostly only a few seconds to a minute. During the treatment, the anaesthetist will continue to give you oxygen and monitor your heart rate and blood oxygen level. Within a few minutes, the anesthetic medication will have worn off and you will wake up. During this time, you will be moved to the recovery room where you will be carefully monitored until you are awake enough to return to your room, or if done on an outpatient basis, you can be taken home. You may only eat 15 to 20 minutes after the treatment. Immediately after the ECT, most people have a short period of confusion and do not remember the actual treatment. The anesthetic will affect your judgment for the first 24 hours. During this time, you must not drive any type of vehicle. A family member or friend should take you home to rest and recover from the procedure. ECT has been used for many years as part of the effective treatment of patients suffering from severe mental illnesses. The value of this treatment is known worldwide. The method has been improved in recent years, yielding better results and fewer side effects. Modern ECT is safe and comfortable for most people.